You might think that COVID-19 virus was already one of the worst pandemic that humanity has ever experienced. Better think twice because you are about to see the top 10 worst pandemic in history. Scientists and medical researchers have for years differed over the exact definition of a pandemic. Is it a pandemic, or an epidemic? But one thing everyone agrees on is that the word describes the widespread occurrence of disease, in excess of what might normally be expected in a geographical region. Cholera, bubonic plague, smallpox, and influenza are some of the most brutal killers in human history. And outbreaks of these diseases across international borders are properly defined as pandemic, especially smallpox, which throughout history has killed between 300 to 500 million people in its 12,000-year existence. 10 of the worst pandemics in history. HIV/AIDS pandemic, at its peak, 2005 to 2012, death toll, 36 million, cause, HIV/AIDS, since its discovery in the Democratic Republic of the Congo in 1976, the HIV/AIDS pandemic has effectively established itself as a worldwide epidemic, killing more than 36 million people. Between 31 and 35 million individuals are now living with HIV, the majority of them are in sub-Saharan Africa, where the infection affects 5% of the population, or around 21 million people. As public knowledge has increased, new medications have been created that make HIV much easier to control, and many people who are infected go on to enjoy fulfilling lives. The number of people worldwide who died from HIV/AIDS decreased from 2.2 million in 2005 to 1.6 million in 2012. Flu pandemic, 1968, death toll, 1 million, cause, influenza. The 1968 flu pandemic, a Category 2 flu pandemic often known as the Hong Kong flu, was brought on by the H3N2 strain of the influenza A virus, a genetic offshoot of the H2N2 subtype. Only 17 days had passed since the first incidence of the virus was recorded in Hong Kong on July 13, 1968, and within 3 months, it had spread to the Philippines, India, Australia, Europe, and the United States. Despite having a relatively low mortality rate, 0.5%, the 1968 pandemic nonetheless claimed the lives of over 1 million individuals, including 500,000 Hong Kong residents, or around 15% of the city's population at the time. Asian flu, 1956 to 1958, death toll, 2 million, cause, influenza, an influenza A pandemic epidemic of the H2N2 subtype known as the Asian flu, started in China in 1956 and continued until 1958. The Asian flu spread during a 2-year period from the Chinese province of Guizhou to Singapore, Hong Kong, and the US. The total death toll from the Asian flu has been estimated to be over 2 million, with 69,800 of those deaths occurring in the US alone, according to the World Health Organization. Flu pandemic, 1918, death toll, 20-50 million, cause, influenza, an unsettlingly lethal influenza pandemic that ravaged the world between 1918 and 1920, killed 20 to 50 million people and infected almost a third of the world's population. The mortality rate of the 500 million persons who contracted the 1918 pandemic was estimated to be 10% to 20%, with up to 25 million deaths occurring in the first 25 weeks alone. The victims of the 1918 flu pandemic were what set it apart from previous influenza outbreaks. In the past, influenza had only ever killed children, the elderly, and patients who were already sick, but this time it started attacking strong, healthy young adults, leaving children and people with weakened immune systems alive. Sixth cholera pandemic, 1910 to 1911, death toll, 800,000 plus, cause, cholera. The sixth cholera pandemic, like its 5 predecessors, began in India, where it claimed over 800,000 lives before moving to the Middle East, North Africa, Eastern Europe, and Russia. The latest cholera epidemic in the United States originated from the sixth pandemic, 1910 to 1911. Only 11 deaths happened in the U.S. as a result of swift efforts by American health officials to isolate the afflicted after learning from the past. Cholera occurrences had drastically decreased by 1923, yet they were still a regular occurrence in India. Flu pandemic, 1889 to 1890, death toll, 1 million, cause, influenza. It was formerly believed that the Asiatic flu, or Russian flu, as it was often known, was an epidemic of the influenza A virus subtype H2N2, but more recent research has revealed that this was not the case. The first occurrences were noted in May 1889 in 3 distinct and remote locations, Greenland, Athabasca, and Bokhara in Central Asia. The flu spread quickly throughout the 19th century due to the rapid urban population development, which only served to accelerate the pandemic's global spread. Although much was learned from it, it was the first actual pandemic in the period of bacteriology. In the end, more than 1 million people died as a result of the 1889 to 1890 flu pandemic. Third cholera pandemic, 1852 to 1860, death toll, 1 million, cause, cholera, the third major cholera epidemic in the 19th century, which ran from 1852 to 1860, is generally regarded as the worst of the 7 cholera pandemics. The third cholera pandemic, like the first and second, started in India and spread from the Ganges River Delta before wreaking havoc on Asia, Europe, North America, and Africa, killing over 1 million people. Working in a deprived district of London, British Dr. John Snow studied cholera cases and finally discovered polluted water as the disease's primary vector of transmission. Unfortunately, the pandemic's deadliest year, 1854, when 23,000 people perished in Great Britain, was also the year of his discovery. The Black Death, 1346 to 1353, death toll, 75 to 200 million, cause, bubonic plague, between 1346 and 1353, Europe, Africa, and Asia were devastated by a plague pandemic that killed between 75 and 200 million people. The plague, which is believed to have begun in Asia, most likely spread throughout continents thanks to the fleas that lived on the rats that were so common in trade ships. Ports were important metropolitan hubs at the time, making them ideal places for rats and fleas to proliferate. As a result, the sneaky bacteria spread, wreaking havoc on 3 continents. Plague of Justinian, 541 to 542, death toll, 25 million, cause, bubonic plague. The plague of Justinian was an epidemic of the bubonic plague that struck the Byzantine Empire and Mediterranean port towns, killing up to 25 million people in its year-long reign of terror and said to have destroyed perhaps half the population of Europe. The plague of Justinian, widely regarded as the first instance of the bubonic plague to be documented, left its mark on the world, eradicating up to 25% of the population of the eastern Mediterranean and wreaking havoc in Constantinople, where at its height it was claiming an estimated 5,000 lives per day and eventually killed 40% of the city's inhabitants. Antonine Plague, 165 AD, death toll, 5 million, cause, unknown. The Antonine Plague, sometimes called the Plague of Galen, was a historic epidemic that afflicted Asia Minor, Egypt, Greece, and Italy. Though the exact source is still unclear, it is believed to have been either smallpox or measles. Around 165 AD, troops returning from Mesopotamia carried an unidentified illness to Rome. Unknowingly, they spread a plague that would ultimately kill over 5 million people and decimate the Roman army.